There are many patients who just aren't ready for surgery. There are patients who don't want surgery, and certainly there are patients that don't need surgery. For these patients, we have what's called non-surgical facial rejuvenation. There are two basic types, fillers and muscle stoppers. Wrinkles form, in general, because of muscle action. I have wrinkles in the front of my jacket because I bend my arm. We have wrinkles here because we frown. We have wrinkles here because we smile. When it comes to certain areas of the face, it is fine and appropriate to stop the muscles. The muscles here have no function except to make those lines. For these areas, where there's no other function besides making lines, it's fine to use Botox or any of the other muscle stoppers so that you don't have the ability to frown. That's better than filling because it lasts quite a bit longer and it is cumulative. For lines like this, you can't stop the muscles because then you won't be able to smile. So lines here, they need to be filled. Whether you use Restylane or Juvederm or Hyaluronic or Sculptra or any of the large number of fillers, they pretty much all act the same and they all last around the same amount of time. Whether it be 6 months or a year, perhaps a little more. There are some fillers that last longer. There are some fillers that last years. One of them is called Artifil. Now, it has only been FDA approved for wrinkles here, but it is useful in many other areas. Which of these fillers is best for you, or which of these treatments, Botox or fillers, is best for you will be discussed at your consultation. It is usually very different and very, very unique to each patient. When it comes to using fillers or even Botox or muscle stoppers, it is easy to overdo it. You've seen people whose lips are too big. You've seen people whose faces are too frozen. The purpose of using a muscle stopper like Botox is not to paralyze your face. It's to get rid of the wrinkles, to make your muscles so weak that they move but they don't make the lines. There's a difference between paralysis and smoothness. When it comes to fillers, if I put too much in your lips, you will look silly for a few months, maybe more than a few months. And that's something I don't wish to do. Bigger is not always better. When doing fillers, especially when making lips bigger, I prefer to be conservative. You can always add a little more. Much tougher, if not impossible, to take it out.